Today I'm doing a physical assessment head to toe. The first thing I'm going to do is I'm going to knock on the door. I'm going to introduce myself. I'm Jewel. I'm your nurse today. I'm going to wash my hands. I'm going to assess my client's area for any kind of safety hazards. And then I'm going to pull the curtain for privacy. Today I'm doing a head to toe assessment on you. And at any point I may need to use an instrument like a stethoscope or touch you. Is that going to be okay?
Yes.
Okay. And what is your name?
Emma Denise Lisby Kelly.
And your birthday?
04/15/05.
I've identified my patient with 2 identifiers. Do you know what year it is?
2021.
And do you know who the president is?
Biden.
So my patient is alert and oriented ×3. Her posture is erect. She's well groomed. And the first thing I'm going to do is I'm going to assess her head. I'm assessing for any lesions, masses, or tenderness. Do you have any tenderness?
No.
Okay. There are no lesions, masses, or tenderness, and there are no parasites present. I'm going to place my hands on your shoulders if you'll try to shrug for me. Okay, and open your mouth and try to close it. Try to close it. Okay, so cranial nerve 11 is intact. The next thing I'm going to do is I'm going to inspect her face. If you'll close your eyes, I'm going to touch her face. If you'll tell me where I'm touching.
Head, chin, left cheek, right cheek.
Okay, so cranial nerve 5 is intact. And then if you'll look at me and you'll smile, squint, and then raise your eyebrows. So cranial nerve 7 is intact. I'm going to inspect her ears. They're both round and symmetrical. There are no lesions, redness, or excess cerumen. If you'll close your eyes, I'm going to rub my fingers on either side of your head. If you'll raise your hand to let me know that you hear the sound. So cranial nerve 8 is intact. The next thing I'm going to do is I'm going to assess her eyes. If you'll look forward for me. And then follow my pen. Don't move your head. Okay, so cranial nerve 3, 4, and 6 are intact. I would normally test her visual acuity by using a Snelling chart. You'll let me know when you see my hands.
I see him. I see him.
Cranial nerve 2 is intact. The next thing I'm going to assess is her mouth. The mucosa is pink and moist. If you'll stick your tongue out, say ah. The tonsils are present and the mucosa is pink and moist. Can you stick your tongue out and move it around? Okay, so she has movement in her tongue and cranial nerve 9, 10, and 11 are intact. There is no discharge, no masses. The tongue is beefy, red, and the texture is rough. There's no lesions inside her mouth. The next thing I'm going to do is I'm going to inspect her nose. The nose is midline. There's no deviation. There is no drainage and no redness, no masses. If you'll take your finger and place it on your nostril and take a deep breath. Now take a deep breath with the other nostril. Okay, both nares are patent. The next thing I'm going to do is I'm going to assess her cranial nerve 11. I'm going to place my hands on your shoulders if you'll try to shrug. Okay, and then against my hand and against my hand. Cranial nerve 11 is intact. I'm going to look at her lymph nodes. In the front, underneath the chin, is the submantle. Midline, or mid-jaw, is submandibular. Back of the jawline is the tonsillar. Front of the ear is the periauricular. Behind the ear is the postauricular. Base of the skull is the occipital. The front is the anterior cervical. The back part of the neck is the posterior cervical. And if you'll kind of show for me, the supraclavicular. All lymph nodes are soft and no tenderness. The next thing I'm going to do is I'm going to inspect her thoracic, lung, and back. I'll turn it to the side for me. I'm going to kind of place my hands at the base of her ribs. If you'll inhale for me. Expansion is symmetrical. Her chest is 2 to 1 in comparison of the diameter. The transverse diameter. And now I am going to assess your lungs. If you'll take a deep breath when I put my stethoscope on you. 1, 2, 3, 4, 5, 6, 7, and 8. Lift your arm. 1, 2, 3, 4, and turn to the back. 1, 2, 3, 4, 5, 6, 7, and 8. My stethoscope should be directly on the skin and not the clothing. I'm going to assess for any costovertebral angle tenderness. Okay. For me. Let me know if you're tender. Any tenderness?
No.
No costovertebral tenderness, angle tenderness. The spine is midline. The next thing I'm going to do is I'm going to assess her carotid pulses. I have to do this individually. I'm going to place 2 fingers on her carotid for about a minute to palpate them. And now I'm going to listen. No brutes are present. I'm going to assess her cardiovascular system. I'm going to go to the second intercostal space on the right sternal margin. This is the aortic. Second intercostal space, left sternal margin, is the pulmonic. Third intercostal space on the left sternal margin is Erb's point. Fourth intercostal space on the left sternal margin is the tricuspid. and the 5th intercostal space parallel with the clavicle is the mitral. S1 and S2 are present and no murmurs. I'm going to oscillate or I'm going to palpate for tactile fermentus. If you'll say 99 as I go down.
99, 99, 99, 99.
The tactile fermentus is normal. And I'm going to place my hand on her chest and assess for any heaves. So no heaves. I'm assessing her respiratory. If you'll just breathe normally for me. Assessing her respiratory rate is normal. She's not using any accessory muscles in order to breathe. And she is breathing with ease. The next thing I'm going to do is I'm going to assess her abdomen. Her abdomen is non-protruding, flat, no distension. I'm going to oscillate first in the right lower quadrant for vowel sounds. Left lower quadrant. Left upper quadrant. Right upper quadrant. Vowel sounds are present in all 4 quadrants. I'm going to palpate her stomach for any tenderness. Abdomen is soft, there's no tenderness, and abdomen is not distended. When is the last time you used the bathroom?
3 or 4 hours ago.
3 or 4 hours ago, and the last time you urinated?
3 or 4 hours ago.
Did you have any pain or discomfort? Were there any problems with your bowel movement or your urination?
No.
Okay, so I've also assessed her state of her gastrointestinal by getting a brief current history of that. The next thing I'm going to do is I'm going to assess her range of motion. If you'll stand up for me. Okay. If you'll just kind of mirror me. Okay. We are going to put our head forward and then backward and then turn to the side and to the other side and then try to bring your ear to your shoulder. Ear to your shoulder. So range of motion in the neck is intact. Okay, so if you'll take your arms and put them out to the side, forward, and then up. So she has full range of motion in her arms. Now we're going to do the same thing with the legs. If you'll bring your leg forward, and then backwards, and then to the side, and do the same thing on this side, forward, backward, and then side. So she has full range of motion in her legs as well. The next thing we're going to do is I'm going to assess her strength in her extremities while she's up. If you'll go ahead and stand up for me. I'm going to press down, you try to press up. Try to press down. Have a seat. Same with the legs. Try to put your foot forward, pull it back, forward, pull it back. Okay, she has +5 strength in all extremities. The next thing I'm going to do is I am going to assess her reflexes. If you'll just relax your arm and look over that direction for me. The tricuspid or tricep reflex. I'll turn over. Bicep reflex. Brachioradialis. Patellar. Achilles. Back of the heel. Right above the heel being Achilles. And on the bottom, I'm going to do the backwards J. No upward flexion. So she's negative Babinski. She has an appropriate reflex for the plantar reflex. The other thing I'm going to do is I'm going to assess her pulses. The brachial. The radial. The dorsalis pedis. Down on the top of the foot. And the popliteal. I've already assessed her carotid pulse. Now, if you'll stand up for me, and you'll walk forward, and then you'll walk backwards. So gait is smooth and even. You'll go ahead and stand up for me. Place your arms to your side and close your eyes. I'm assessing for her sense of balance. She's got a negative Romberg test. Go ahead and have a seat. I'm going to check her capillary refill on her fingers, both hands. Capillary refill is good on the hands. And then I'm going to check it on her toes. Capillary refill is good. Trying to make sure I okay. Here is your colli. Here are your belongings. I'm going to assess my patient's room for any kind of safety issues. Make sure she's comfortable. Are you comfortable? You have everything you need?
Yes.
Okay. I'm going to go document and I will be back in about an hour. I'm going to wash my hands. I'm going to pull the curtain and that is it.